Welcome guys to Registered Nurse Ovie. In this video we'll be talking on electrocardiogram, written for short as ECG or EKG. EKG is gotten from the German word electrocardiogram, where cardio is started with the spelling with the letter K, while electrocardiogram is an English word. So whichever time you come across it, remember EKG means the same thing. Electrocardiogram simply refers to the electrical activities as a graphical representation of electrical activities that occurs within the heart. Remember in our previous video we said the heart has the ability to generate its own impulses. So now I'm telling you that these electrical activities that occur within the heart, this impulse that are caused by those specialized fibers that are responsible for generating those electrical activities. That is the SN node, the AV node, the AV bundle, the bundle fibers, and the Purkinje fibers. All these electrical activities, the movement and the recording of it, whatever you may talk about, are recorded graphically, and this record is referred to as electrocardiogram. That is the graphical representation of electrical activities that occurs within the heart. Take note of that. Now the printout of it, that is the paperwork of it, is referred to as an electrocardiograph. Now the electrocardiograph has numerous importance, some of which include it helps to identify the normalcy of contraction in the heart, that is the importance of ECG. One, ECG will help us to identify the normal contraction, that is if the heart is contracting normally or not. So take note of that, normal contraction. While secondly, it helps us to identify the various parts of the heart where there is a damage, that is damaged heart. That's another function of the heart. Then ECG also helps us to identify the cause of chest pain, that is the etiology of chest pain. And lastly, ECG will also help in the identification of an enlarged heart, that is enlarged heart. So if the heart is enlarged, performing an ECG will help you to identify any of these functions or all of these functions. Normalcy of contraction, that is if the heart is contracting and relaxing normally. The damage to the heart, that's which part of the heart is damaged, the cause of the chest pain, and to help you identify if the heart is in normal size or it is enlarged. So take note of that. Those are the importance of ECG. Now talking about the ECG, ECG is divided into the ECG. Normal ECG has three waves, which are the P wave, the Qrs complex, and lastly we have the T wave. So from the diagram here now we can see here that these are the waves that are occurring within in an ECG. 1, 2, 3, and this. So the P wave, the Qrs complex, and then lastly we have the T wave. So talking about the P wave now, the P wave simply represents what? Arterial contraction. That is, it is due to impulse from the SN node, that is impulse generated from the SN node or whatever, but the P wave represents arterial contraction. The Qrs complex represents what? Ventricular contraction, while the T wave represents what? Relaxation of the cardiac muscles. So these are what these three waves of the ECG represent. So going into detail of the explanation, the P wave starts with a little curve which goes from up to down. This is the P wave. From here we have our P wave like this. So the contraction, the stimulation of the SN node, that's the impulse from the SN node or action potential from the SN node, will cause the atrium to contract, and this usually lasts between 0.1 second. That's the time frame for the P wave to form. So this lasts for 0.1 seconds from impulse from the SN node, which causes the contraction of the atrium, the left and the right atria. On the left and the right atria will be contracted upon action potential from the SN node. So when this occurs now, it forms a slight curve which comes downward and back to the line. So the next now is the Qrs complex. The Qrs complex simply represents what? The contraction of the ventricles, that is the left and the right ventricles, and it first of all comes downward, it moves downward, then goes upward, forming an upright triangle this way, and comes downward again, ends downward. This is the Qrs complex. So we have the P wave, the Qrs complex, and lastly the T wave. Remember, we said earlier that the T wave represents what? The relaxation of the cardiac muscles. So this represents what? The T wave. The T wave is a dome shaped, so it just goes upward and downward. Now the time frame for the Qrs complex, we said the time frame for the P wave is 0.1 second. The time frame for the Qrs complex is 0.3 seconds for a normal heart, and the time frame for the T wave, that is the ventricular, the relaxation, is what? 0.4 seconds. So altogether we have a total of 0.8 seconds for an ECG to form, and this is just one cycle. So for us to get a contraction and relaxation of the cardiac muscle, for us to get a complete ECG representation like this, it simply means that what? The heart is contracting that's within 0.8 seconds. It simply means that what? The heart contracts at a rate of 75 beats per minute. So we say what? 75 beats per minute, and that's for 0.8 seconds. You know, the heart rate varies from individual to individual, so it varies, but we took a typical heart rate of 75 beats per minute. So take note of that. There's the P wave, the Qrs complex, and then the T wave. Do not forget. The next we'll be talking about now is the Ecg intervals and segments. The Ecg has 2 intervals and 1 segment. The first interval is the PQ interval. The second one is the QT interval. And lastly, we have the ST segments. Segment of that. Now these 3 intervals or segment, that's these 3 over here, they have different things which they represent. The PQ interval starts from the beginning of the P wave and ends at the beginning of the Q wave. That is, it's from the beginning of P wave to the beginning of Q wave, and what it represents is what? Atrial contraction, atrial contraction. That's what the PQ interval represents, and it also represents the time with which the impulse travels from the atrium to the AV node and then to the AV bundle fibers. Remember from our previous video where we talked about this diagram, we said the SA node is over here, we have the AV node, the bundle branches, and then the Purkinje fibers. So this PQ interval now represents the time with which the impulse travels to the various atrium, causing contraction of the atrial wall, that is the contractile fibers of the atrium, and then the transmission of the impulse from the AV node down to the conducting fibers. Talking about the conducting fibers, it means what? The AV bundle, also called the bundle of A's, like I said in the previous video, down to the Purkinje fibers, the time with which the impulse travels through that route. So that's that for that. Then talking about the QT interval now, the QT interval simply represents ventricular depolarization and repolarization. That is the time for the time taken for ventricles to depolarize, that is contract, and then for it to relax again. Remember, we said that the Qrs complex represents ventricular depolarization, while the T wave represents what? Ventricular repolarization. So the QT interval now represents what? The time taken for ventricular depolarization and ventricular repolarization to occur. And lastly, now talking about the ST segment. ST segment starts from the end of the S wave and ends at the beginning of the T wave, and it represents the ventricular repolarization, that is the time taken for ventricles to repolarize. Remember, these are the segments and intervals of the P wave. So this will bring us to the end of the ECG. Thank you very much for watching. Please do well to subscribe to the channel to be notified when a new video has been uploaded.